First topic that we are going to study in oral radiology is radiation physics. All right. So before proceeding to radiation physics, you should know some basic points that we need to know about basic physics first. All right. So first basic structural unit that we know is an atom. All right. So atom basically consists of the nucleus. Okay. Nucleus consists of protons plus neutrons. All right. And electrons that revolves in the orbitals. All right. So this is a nucleus which contains protons plus neutrons. And then electrons are there in the surrounding orbitals according to the energy or according to their atomic number of an element. All right. So this atom is said to be in the neutral state, said to be in the neutral state when number of electrons equals number of protons. All right. But when you remove or add particular electron, okay, then it becomes an ion. When you add or remove electron, okay, that atom converts into ion. Okay. Now, this process is called as ionization. This process is called as ionization. All right. And this ionization process requires particular energy. All right. Now, the ionization process that is happening, it requires particular energy. Requires energy. And that energy should overcome the binding energy of the electrons. Okay? That energy should overcome binding energy of electron. Binding energy of electron. Now, what is binding energy of electron? Since nucleus is positively charged, since they contain protons, okay, the protons and electrons will have some attraction, electrostatic attraction. Okay, the electrons will be bound to the nucleus with some energy that is called as binding energy. And for this ionization process, we need to overcome this binding energy of an electron. All right, and this depends on the atomic number of an element. Atomic number of an element. Okay. Now, what is atomic number? Atomic number equals number of protons. Atomic number equals number of protons. The more number of protons, more it will tightly bound the electrons. Okay. So high atomic high atomic number. Okay. Binds electrons tightly as compared to low atomic number. Low atomic number. Alright. I hope this is understood. Okay. I'll explain it again. So, what is an ionization? Ionization process is addition or removing of the electron from the orbital. Okay. Now, this process of ionization requires energy which should be greater than the binding energy of an electron. Okay. Binding energy of an electron is the electrostatic attraction between the nucleus and the electron. Nucleus meaning the protons. Protons and the electrons. Okay. So protons will hold electrons tightly depending on the number of protons present in the nucleus. And this number of protons depends on the atomic number of an element. So more number of protons, more tightly it will hold the electron towards it. Okay. And more energy we should put to remove the electron from the surrounding orbital. Okay. More it is difficult for ionization process. All right. So this is the basic concept. And this concept, you will understand why I am explaining, because we are going to study about radiation physics and radiation biology further. So you will understand what this the correlation between this concept and the concept we are studying further. All right. I hope this is understood. You can just post it in the group. Okay, if you understood, and if you not understood, you can also post it. I'll explain it again. All right. Okay. So this is basic. Now, let's move on to the radiation. Radiation. What is radiation? Radiation is just a transmission of energy through space and matter. All right. Radiation is transmission of energy through space. Okay. Now, radiation we are going to divide into two. That is particulate radiation and electromagnetic radiation. Electromagnetic radiation. All right. Now, particulate radiation is what, and electromagnetic radiation is what? Particulate radiation is a tiny, or also a tiny particles, okay, in the form of tiny particles of matter, okay, and these tiny particles possess mass. This possess mass. Okay. They travel in straight line and with high speeds. Travel in straight line and at high speeds. Okay. So particulate radiation are something tiny particles which have mass and which travels in straight line and with high speeds. Okay. So there are types of particulate radiation that we are going to discuss. First particulate radiation that we have, that we all know, is electrons. So electrons are also classified into two according to its origin. Okay. So first we have is the beta particles, and second we have is the cathode ray. Okay. Beta particles. The origin of beta particles is what? Nucleus of radioactive atoms. Nucleus of radioactive atom. All right. And cathode rays are high speed electrons. Cathode rays are high speed electrons originated in the X-ray tube. Okay. Now, when we discuss about X-ray tube, there you will understand what are cathode rays exactly. All right. So electrons. Then we have second one, which is alpha particles. These are the types of particulate radiations that you should just know the names of. Alpha particles. These arises from nuclei of heavy metals. Nuclei of heavy metals. All right. These alpha particles contains two protons plus two neutrons with no electrons. All right. Alpha particles are nuclei of heavy metals. Third one we have is the protons. Okay. Protons means we all know. Protons have mass of 1, charge of +1. All right. And we can consider hydrogen nuclei as a proton. Okay. So it has got mass of 1 and charge of +1. Fourth particulate radiation that we have is the neutrons. Okay. Neutrons will have mass of 1 and charge. Neutrons means no charge. No charge. Okay. Zero charge. So these are types of, sorry, particulate radiation. And now we will study about electromagnetic radiation, which is very important in radiation physics. All right. Now, electromagnetic radiation. Okay. This is propagation of wave-like energy. Okay. In particular, there was a particle with mass and which was moving at high speed. All right. What is electromagnetic radiation? It is a wave-like energy. Wave-like energy. All right. In a particular spectrum called as electromagnetic spectrum. All right, now this is electromagnetic spectrum. Starting from gamma rays to radio waves, we have these electromagnetic radiations. Gamma rays have highest energy. Okay, gamma rays, then comes X-ray, then comes UV rays, then comes visible spectrum, then infrared, microwaves, and radio waves. Moving from right to left, okay, we have this gamma rays with higher energy and radio waves will have a lowest energy. Just remember one relation here, that wavelength, okay, or energy is inversely proportional to wavelength. That means if the energy of particular radiation is high, the wavelength will be low. Okay, since they are inversely proportional. Okay, so gamma rays here, gamma rays will have higher energy and lowest wavelength. Just remember, okay? You can get MCQ regarding this. Gamma rays will have lowest wavelength, whereas radio waves will have a highest wavelength. All right? Radio waves will have a highest wavelength. Uh, all right. Now, the radiation which have got lowest energy, that is infrared, microwave, radio waves, they don't have capacity to ionize. Okay, so they are not capable of ionizing. Whereas the gamma rays, X rays, UV rays, they have got higher energy, so they are capable of ionizing. Okay, and ionization is very harmful for the tissues. Okay, that we'll discuss in radiation biology. Why I am uh, uh, I'm giving importance to ionization, because this process is important when we study about radiation biology. Okay, the effect of radiation on living tissues. All right. So this gamma rays, X rays, and UV rays have got this ionizing capacity. Okay, whereas the infrared micro visible light, infrared microwaves, radio waves, they are not capable of ionizing. Okay. So this is an electromagnetic spectrum. Just remember which has got highest wavelength, which has got lowest wavelength, which has got highest energy, which has got lowest energy. All right. Then we'll move on to the types of X-rays. So there are different types of X-rays that you should know. All right. Starting from super soft X-rays. All right. Super soft X-rays. Then soft X-rays, medium X-rays, and hard X-rays. All right. As you look into the names of it, you will understand what is the purpose of these X-rays. Okay, in which therapy it is used, whether it is diagnostic or not. All right. So super soft X-rays have wavelength of 1 to 2 Armstrong. All right. Super soft X-rays have less energy. Super soft means they have no energy, less penetration power, less penetration power. All right. And they are not used diagnostically, no diagnostic use. All right. And they can be used to treat superficial lesions. Superficial lesions. Treat. All right. So super soft X-rays have got wavelength of 1 to 2 Armstrong. They have got less energy, less penetration power. Third, they are not used for diagnostic purpose. Fourth, they are used for treatment of superficial lesions. All right. Then we come on to the soft X-rays. Soft X-rays will have a wavelength between 1 to 0.5 Armstrong. All right. And these X-rays are used in contact therapy. What is contact therapy? Contact therapy is a type of treatment. Example, used in the psoriasis. Psoriasis is a dermatological condition where you get the rashes onto the skin. Okay, for treatment of that, you can use this soft X-rays. All right. Then come on to the medium X-rays. Medium X-rays will have a wavelength between 0.5 to 0.1 Armstrong. They can be used as for the diagnostic purpose. All right. And also superficial therapy to treat lesions. Superficial therapy. All right. Uh, hard X-rays, as the name suggests, it will have a wavelength of 0.1 Armstrong. It will have a maximum penetration power, and it is used for a diagnostic purpose. Okay. These are types of X-rays. They can ask you which X-rays are used for diagnostic purpose. Uh, which X-rays are called grains X-ray. Grains X-ray are super soft X-rays. Grains X-ray are the another name for grains X-ray are super soft X-rays. Okay, grains X-rays. Just remember this. All right. So these are types of X-rays that you should know. All right. Then we'll move on to the one important concept that you should know, which is linear energy transfer. Linear energy transfer. What is linear energy transfer? Now, I'll give you an example. I'll simplify the concept. This is a rate of loss of energy from a particle, okay, as it moves through a irradiated material. Okay, what is this? Rate of loss of energy. Now, LETY, the significance of LET is you will get to know which type of radiation is very harmful or more damaging. Okay, rate of loss of energy from a particle. Okay, as it moves through an irradiated material. Irradiated material. Okay, meaning what? Okay, meaning the capacity of particulate radiation to ionize particular, say, you are passing it through a tissue. Okay, the capacity of particulate radiation to ionize, okay, depends on the LET, linear energy transfer of that particular radiation. Okay, so the capacity of particulate radiation to ionize, okay, atoms depends on, depends on, okay, now it depends on the mass of the particle, velocity of the particle, all right, and charge of a particle. Okay, mass, velocity, and charge. Now I'll compare this with the say you have fat person and you have a thin person. All right, and we take example here of alpha particle and say X rays. Okay, X rays, alpha particle and X rays. Okay, so alpha particle is or have greater physical size. Okay, size of alpha particles is greater as compared to X-rays. Size is lesser. Okay, say this compare with the fat and thin person. Okay, fat person ka size greater, thin person ka size is less. All right, so the size is greater, that means the charge is greater. Okay, charge will compare it with the laziness. So fat person will be more lazier as compared to the thin person. All right, not in every case, just we are taking the example here. Okay, so charge is greater, the velocity will be lesser in alpha particles. Okay, because of size. Okay, so fat person will run at slower speed as compared to thin person, right? So fat person will have a less velocity, okay, and thin person will can run faster. All right, so velocity of thin will be greater. All right, I'm just comparing so that this concept is easier to understand. All right, so the high charge and low velocity of alpha particles. Okay, alpha particles are more ionizing as compared to X rays. All right. So alpha particles are more more ionizing. Okay. When they are passed through a tissue, they lose kinetic energy rapidly. Okay. Because they are moving at slow speed. And then there are the time that alpha particles get to ionize atoms is more because of slower velocity. Okay, so they are more ionizing as compared to X rays. Okay, as compared to X rays. All right, and therefore the alpha particles have higher LET. Okay, alpha particles have higher LET and X rays have lower LET as compared to alpha particles. Okay, so fat person will have a high LET, thin person will have a low LET, linear energy transfer. So the radiation with high LET or linear energy transfer are more damaging. Okay, more damaging. So alpha rays are more damaging. You can get MCQ. Which of the following radiation or particulate radiation is more damaging? You will write alpha particles or alpha rays. All right. I hope this concept is understood well. If not understood, you can post it in the group. I'll explain it again. All right. Okay. So these are some important concepts that you should know. Then we have something called as very important to start with X-ray tube. All right. You must have seen X-ray machine in your say radiology room. All right. What is this? This is an X-ray tube head. Okay, tube head, which is attached to the arm, and then arm is attached to the wall. All right. This is a tube head. Okay, tube head. Now, inside this tube head, we have the X-ray tube. All right. If you can just correlate this picture, okay, with this illustration, you will see this is a X-ray tube head. Okay, inside which we have X-ray tube. Okay, which produces X-rays. All right. Then we have power supply. Okay. And surrounding this X-ray tube, we have the oil, insulating oil. Now, why these components are important and what is the use of these components, we are going to discuss. All right. At the window, at this is aiming cylinder, or you can also call it as PID, which is position indicating device. At this window, you have aluminum filter. All right, aluminum filter, which will filter out the scattered radiation or low energy photons. You will understand it once we proceed further. You also have collimator here. Collimator is just maintains or regulates the shape and the size of the X-ray beam. All right. So at window you have collimator, you have filter. All right, and this is PID or aiming cylinder. All right. Inside it, we have X-ray tube like this, surrounding with insulating oil and attached to power supply. All right. So this is the tube head basics. Now we'll move on to the X-ray tube. Okay. So this is the X-ray tube. This is how X-ray tube looks. Okay. X-ray tube basically consists of cathode and anode. All right, cathode and anode. Cathode is negatively charged, anode is positively charged. Here, if you can see here, this is a cathode, and here this is a anode. The small thing you can see is the anode, and this is attached to the copper stem. This is a copper colored. This is basically a copper stem. Okay, what is the use of copper stem? We are going to discuss. All right. So this is anode, this is cathode, this is anode. All right. Primary components of X-ray machine will discussed. What are the primary components?
कोई बात नहीं आप चले जाओ बाहर से
What are the primary components of X-ray machine? Okay. First and very important, X-ray tube, of course. Okay. Second one is the power supply. Okay. So these two basically makes X-ray machine work. All right. Starting with the X-ray tube, this is how we have our X-ray tube. Okay. You have cathode here. Okay. You have cathode. What are the components in cathode? Okay. That we are going to see. Okay. So we have cathode and we have anode. All right. Cathode is negatively charged, anode is positively charged. Cathode consists of filament, which is made up of a tungsten. Okay, tungsten filament. And then we have this molybdenum cup. Molybdenum cup. It is also called as focusing cup, basically. Okay, focusing cup, which is made up of molybdenum. All right, and this tungsten filament, the diameter of it is 2 mm. Okay, there is a coil of tungsten filament with diameter of 2 mm. And then we have focusing cup, which is molybdenum cup. Okay, and it focuses towards anode. what is the significance of focusing? Okay, what it is focusing, that we'll discuss. Okay, so focus is towards unknown. All right, it is of parabolic shape. Parabolic shape. If you look at this, okay, so this is tungsten filament with diameter of 2 mm. This is molybdenum cup, okay, which focuses the electron cloud. Okay, how this electron cloud forms, that we'll discuss. Okay, so molybdenum cup with tungsten filament makes up the cathode unit, all right, which is negatively charged. All right, done with cathode. Now we'll move on to anode. Okay, so anode consists of tungsten, tungsten target embedded in copper stem, embedded in copper stem. All right. So anode basically made up of a tungsten target with or embedded into the copper stem. What is importance of this copper stem? During X-ray production, what happens is during X-ray production, the excessive heat which is produced at anode will be conducted by copper stem. Okay, excessive heat which is forms during X-ray production will be conducted via copper stem. That is why it is embedded into copper stem. Okay. Now, what is the importance of this anode or target, tungsten target? Okay. It will convert. It will convert the kinetic energy of electrons into X-ray photons. Into X-ray photons. Okay, and the you can say the heat and the X-ray production that is happening at cathode, 99% of heat is generated. Only 1% is converted into X-rays or X-ray photons. Okay, at anode, this is the equation which is going on. 99% of heat is produced and only 1% of X-rays are produced. All right. Okay. Now, if we talk about this glass tube, all right, this is a glass tube, right? So this glass tube is made up of lead beryllium glass. All right, glass tube is made up of lead beryllium glass. All right, and this lead beryllium glass is evacuated from inside. Now I will ask this question after I teach you X-ray production, how the X-rays are produced, why there is a vacuum created inside this glass tube. Okay, there is a glass tube which is evacuated completely. Okay, so why they are evacuating the X-ray tube? I'll ask you in after I teach X-ray production. All right. Okay. And one important thing that we studied, cathode is made up of a tungsten coil. Anode has also a tungsten metal. Now, why we are using tungsten here? Okay. Why we use tungsten here? Okay. So the reason being, tungsten have first, tungsten have high atomic number. All right. Second, tungsten have got high melting point. Third, tungsten have high thermal conductivity. All right. Fourth reason is tungsten have low vapor pressure. What is significance of it? High atomic number means you will get efficient X-ray production. Efficient X-rays. Okay. High melting point, the X-ray tube works on very high temperature. Okay. So we need to use an element which has got high melting point so that it does not get melt with such a high heat production. So high melting point, it withstands high temperature, high temperature, and melting point of it is how much? 3380 degrees Celsius. All right. High thermal conductivity, it will dissipate heat away. Okay. It will dissipate heat away. All right. Low vapor pressure, low vapor pressure, it will maintain the vacuum inside the X-ray tube. All right. Maintains the vacuum inside the X-ray tube. If the tungsten would not have low vapor pressure, then what will happen? The vapors will be created, and those vapors will be collected on the glass tube, okay, or solidify on the walls of the glass tube, okay, and that uh, is called as sun burning or sun tanning effect. Okay, so vapors, if solidify on glass tube, walls of glass tube, then it is called as sun burning or sun tanning effect. Okay, and what happens is then it reduces the output of X-ray tube, and it reduces it destruct the vacuum which is created inside the glass tube. All right, and what do we do is we add little thoria to the tungsten to make the tube last longer. Okay, thorium is added. Thorium is to tungsten. Added to tungsten to make tube last longer. Okay, so I hope you understood the use or importance of tungsten. Why we are using tungsten? Because it has got high atomic number, high melting point, high thermal conductivity, high low vapor pressure. High atomic number so that it will give us efficient X-ray production. High melting point because it withstands high temperature. All right. High thermal conductivity, it will dissipate heat which is created during X-ray production. Low vapor pressure, it maintains the vacuum inside the X-ray tube. All right. Now I'm going to explain how the X-rays are produced. Okay, how the X-rays are produced. Now, first you switch on the X-ray unit. All right, switch on the X-ray unit. The voltage and the current, okay, and exposure time is set. All right, you switch on the X-ray tube. What happens is the line voltage, okay, line voltage of 110 to 220 volts pass through it, okay, and what happens is it will heat the filament over here. It will heat this tungsten filament. All right. Now there is a catch. This line voltage
क्यों?
has to reduce into 3 to 4 volts to heat the filament. Okay, the filament just needs 3 to 4 volts to heat up.
बोलो
Okay, so here there is a little catch that I'll tell you later. Okay,
आ जाएगा
voltage, you switch on the button. Okay, heat up the filament. Okay, there is electron cloud which is created here when you switch on the button. All right, electron cloud which is created means a lot of electrons are created here, and this cup will focus these electron cloud towards anode. Okay, it will just restrict this electron cloud so that when you press the exposure button, the electron cloud will move with a higher speed, with a kinetic energy towards this anode and hit this anode target. So you switch on the button, there is electron cloud being created at cathode. Okay, heating up of the tungsten filament. Okay, now you press the exposure button. Okay, cloud created at cathode. Then you press the exposure button. Okay. Now, why this exposure button we press? Because now you need to increase the potential difference between the cathode and the anode. Okay. When potential difference is increased, this electron cloud will move with the kinetic energy, towards anode. Okay, we need to increase the potential difference so that the electron cloud which is created at cathode will move with the faster speed towards anode and hit this anode target. So that there are X-ray photons which is being created at anode. All right. This is the procedure of X-ray production. Okay. Now you press the exposure button, electrons will move with higher speed, will hit the tungsten target, and then we'll get the X-rays or X-ray photons are created over here, which will come out of this window of this tube head. Okay. And useful X-ray beams comes out of it. This is the summarized procedure, or you can say the procedure for X-ray production. All right. Now, here at anode, when X-rays are produced, there is a lot of heat which is being produced. And I already told you 99% of heat is created. Only 1% of X-ray photons are being created over here, which comes out of the X-ray tube. All right. So this is the procedure. Now, I talked about primary components of X-ray machine. So X-ray tube being one of them. And second one is the power supply. Now, power supply plays very important role in this X-ray production. All right. Now we have power supply. What is this power supply? Okay. So X-ray tube have got two types of transformers. All right. First is step down transformer. Second one is the step up transformer. All right. Step down transformer, what it will do, I already told you the line voltage is of 110 to 220 volts when you switch on the button for X-ray machine. All right. So step down transformer will reduce the line voltage of 110 to 220 volts to 3 to 4 volts, which is needed to hit the tungsten filament, which is needed to hit the tungsten filament. All right. And then we have step up transformer. Step up transformer comes into play when there is an electron cloud created. Now we need to send those electron cloud towards anode with a more speed. So we need to increase the potential difference between anode and the cathode. That time this step up transformer comes into play, where this step up transformer will increase the line voltage of 110 to 220 volts to 65,000 to 1 lakh volts. This is the voltage needed, okay, to send those electron cloud towards the anode with such a high speed so that there is X-ray production happening. Okay, so there is step up transformer that comes into play. Okay, so we have two circuits here, step down transformer maintains this filament circuit, okay, tungsten filament, and step up transformer will maintain this cathode to anode circuit. Okay. So there are two transformers. There is auto transformer also uh, in the or attached to the tube. Okay. Repeat step up, step down. All right. Okay. So there is a power supply of X-ray machine. All right. We have this transformer. This is basically a transformer added in the X-ray tube or X-ray machine. Basically, step down transformer. What will it do? The line voltage, normal you charge the phone, the line voltage is 110 to 220 volts. Okay. Same. When you switch on the X-ray machine ka button, you get 110 to 220 volts ka line voltage. Okay. But to heat the filament here, the filament is 2 mm diameter. To heat the filament, we need not need this much of voltage. So the line voltage has to be reduced to 3 to 4 volts, right? And that work is done by step down transformer to reduce line voltage from 110 to 220 volts to 3 to 4 volts. Okay, so that the tungsten filament gets heated up. All right, now step down transformer ka kaam is over. Now you need step up transformer to get into it. Okay, now you have the electron cloud created over cathode. Now you need to send those electron cloud towards anode, right? Towards anode with high speed so that X-ray photons are created. Okay. Now to reach this much of energy, what we need is the line voltage of 110 to 20 is not enough. We need to increase that voltage. And the step up transformer will increase this line voltage to 65,000 to 1 lakh of volts. All right. So there are two units basically, or two circuits basically. First is filament circuit, that is tungsten filament. To heat up tungsten filament, you need step down transformer. And to heat up cathode anode or to increase the potential difference between cathode anode so that electron cloud will move with a speed towards anode, you need this step up transformer. All right. I hope you understood this, Disha. Okay. So we have auto transformer also. Auto transformer is just additional thing. Okay. If there is some fluctuation in voltage, then auto transformer will adjust this small fluctuation. Disha, you understood? I hope you understood this. Okay. Auto transformer is just okay, fine, good. Voltage compensator. It is called as voltage compensator. Okay, means it can act as a step down transformer in need, or it can act as a step up transformer in need. Okay, when in need. All right. Uh, Next uh, segment is the factors affecting X-ray production. Okay, what are the factors that affect X-ray production? Okay, so starting with the exposure time. Now this is very important, and this concept is quite complicated. I understand, but if you get it, you will remember it for the longest time. All right. So exposure time. When you increase the exposure time, okay, when you increase the exposure time, what happens is the electron produced at the cathode, electrons produced at cathode will be increased, meaning what? The electron cloud, the number of electron cloud will increase. Okay. Then simultaneously, the electron cloud which is formed at cathode will be sent to anode. So there is increased electron going towards anode. All right. And that will finally result in quantity quantity of X-ray photons. Okay, increase in quantity of X-ray photons. Okay, जितना ज्यादा इलेक्ट्रॉन्स पहुंचेगा एनोड तक उतना ज्यादा एक्सरे फोटॉन्स फॉर्म होगा. Okay, meaning exposure time may increase. There is increased electrons at cathode, then increase electron moving towards anode, and the quantity of X-ray photons that are produced will be greater. Okay, so exposure time depends or directly influence quantity of X-ray photons. All right. Next, next we have is the tube current. Tube current. Okay, tube current is milliamperes. Okay, exposure time seconds. Tube current, when you increase tube current, all right, the filament, heating of filament increases. Then electron produced at cathode increases, and again this will increase or influence quantity of X-ray photons. All right. Now, in your exam, in your NEET exam, what they ask is the quantity of X-ray photon depends on what? Example, options: MA, that is tube current, exposure time, both, or KVP, that is voltage. Okay, so if they have given MAS as an answer or as one of the option, then you will mark MAS as a correct option. All right, which is exposure. Uh, the quantity of X-ray photon depends on exposure time and tube current. Okay, so quantity of, write down, quantity of X-ray photons depends on MA or tube current and exposure time both. Okay, but if they have not given MAS in the option, you will go for either exposure time or MA or tube current. Okay, they'll give you one of the option, not both. Okay, so tube current will be ideal answer in those situations. All right, but if they have given MAS, then you will mark MAS. All right. Okay. Then we have next factor, which is which influences X-ray production, is your KVP. KVP, which is tube voltage. Tube voltage. All right. Now, when you increase the tube voltage, what happens is there is increased potential difference. Potential difference between anode and cathode. All right. In this potential difference, will increase the energy of electron cloud. Okay. Increased potential difference will increase energy of electron cloud that is formed at cathode. All right. And they will send the electron cloud with maximum energy towards anode, and there is maximum energy X-rays are produced. Okay, maximum energy. Initially, I told you energy is inversely proportional to wavelength. So they will have lowest wavelength. All right. Maximum energy meaning maximum penetration power of X-rays. Okay. What is the significance of it? This controls the quality of X-rays. This controls quality of X-rays. So MCQ regarding this quality of X-rays are or controlled by KVP, which is tube voltage. All right. Quality controlled or influenced by KVP, which is tube voltage. All right. I hope you understood this. Fourth factor that we have is the inverse square law. Inverse square law. Now, what is inverse square law? This is the formula that we are going to follow here. Okay. So, intensity of X-ray beam. What this mean? Intensity of X-ray beam, all right, is inversely proportional to the square of distance. Square of distance from the source. From the source. Okay. Now, you may get MCQ, numerical based MCQ based on this formula. Okay. Say example, dose of 1 gray, dose of 1 gray measured at a distance of 2 meter, measured at distance of 2 meters. All right. Dose of 4 gray will be measured at what distance? Okay. You will just put this value into the formula which is given above. All right. So say we consider this as a I1, I2. Okay. This is D1. D2 we need to find out. All right. So I1 upon I2 is equal to D2 square, which is we need to find out upon D1 ka square, which is this. All right. So if you solve this, you get D2 as 1. Okay. So dose of 4 gray will be measured at distance of 1 meter. Okay. This is how you will solve the numerical based question. Okay. When you get such kind of questions. All right. Fifth factor that we have is the filtration, on which the X-ray production or factors affecting X-ray production. Okay. Fifth, we have filtration. And sixth, we have the collimation. Okay. Now, these two we are going to be discussing in detail when we study about X-ray films and accessories. Okay. That time I'll tell you what uh, element is used in filtration, the shape of collimation, what it should be, what how this collimation works or filtration works. All right. So we'll take 5 minutes or 10 minutes. So let's start again. Now, as we discussed about the cathode and anode, all right. Basically, anode is angulated at some degree. All right. If you look at this image clearly, all right, this is angulated at some degree. Now, what is the reason behind it? Okay. This reason behind this is uh, when we study about principles of projection geometry, in that the first principle that we have is the source. okay, should be as, or focal spot should be as small as possible. Okay, so this is basically our focal spot. Alright, so focal spot should be as small as possible. Okay, uh, theoretically it should be a point source, means it should be a point like a small source. Okay, so that we get sharper image, but uh, practically it is not possible. Therefore, what we do is node is angulated to some degree, and this principle we call it as a line focus principle. Okay, line focus principle, or it is also called as angle of truncation. Angle of truncation, or it is also called as Benson's principle. Benson's principle. All right. Here, what we do is we angulate the anode at 20 degrees. 20 degrees. So that what happens is, if you look at this here, if you look at this, the actual focal spot size is 3 into 1 into 3 mm. Okay, actual focal spot size is 1 into 3 mm. But when we angulate the anode, the effective focal spot size is reduced to 1 into 1 mm. Okay. Finally, what we need to do is we need to reduce the size of focal spot so that we get sharper image. All right. So angulating the anode at 20 degree, we are getting the effective focal spot size, which is 1 into 1 mm, and which will give us a sharper image. But why we are angulating? Why we are not using the same like 1 into 1 size only? Because we need the greater surface area also at anode. Because at anode, what is happening? There is excessive heat which is formed during X-ray production, right? Excessive heat formed during X-ray production. So to dissipate this heat, all right, we need the surface area greater, but at the same time, we need the size smaller. So what we do is we just angulate this size of focal spot so that we get reduced size. Okay, the significance of it: sharper image. Second one is dissipation of heat, proper dissipation of heat we are getting. All right. So line focus principle or Benson's principle of or angle of truncation is all about this. All right. Uh, okay. Then we will move on to the interaction. Okay. Which interaction now? When this electron comes and hit this target anode, all right, there are production of X-ray photons which is taking place. Now this production of X-ray photons, how this interaction is happening, that we are going to study. Okay. All right. So electrons convert electron cloud, which is from the cathode. Electron converts their kinetic energy into X-ray photons, right? When they hit onto the anode. Okay. And this will convert the electron into X-ray photons. And there are two types of X-ray photons that can come out. There are two possibilities. First is the Bram-Starling radiation. Bram-Starling radiation. Second one we have is the characteristic radiation. Characteristic radiation. Okay. So there are two possibilities when electrons comes and hit onto the X-ray, anode target. All right. So what is this Brahms-Starling radiation? First, Brahms-Starling in German. Brahms-Strahlen in German, meaning breaking. Okay, breaking. Okay, so it is also called as breaking radiation. Okay, or it is also called as white radiation. Okay, so when the electron comes and hit the anode, there are two possibilities. Okay, where first is direct hit, means the electron which is coming, incident high energy electron which is coming directly hit the nucleus. Okay, and there is a Brahms-Starling photon of maximum energy which can come out. All right. The second possibility is the incident high energy electron will come and pass by the nucleus. It do not hit directly on the nucleus. It passes by the nucleus. And when it passes by the nucleus, and since there is a attraction between nucleus and the electrons, okay, since they are oppositely charged, okay, the energy of the electron will be decreased. It is also deflected onto different path. Okay, so there is deflection and there is a deceleration of electron. Okay, and there is a coming out of Brahms-Starling photon of lower energy. All right, so there are two possibilities: direct hit and near miss interaction. Okay, and most of the X-ray photons which comes out of the X-ray tube are of this interaction or Brahms-Starling radiation. Okay. Uh, all right. So why this is a breaking radiation? Breaking radiation, uh, because this high energy electron which comes, it passes by the, it is deflected through the path, and the energy is also decreased. Okay, decelerated, speed is also decreased. So there is a break in the action or break in the, you can say, the path of the electron. All right, so this is Brahms-Starling radiation. Okay, and most radiation are of Brahms-Starling type. Most radiation are of this type. This type. All right. Second possibility when electron hit the anode is characteristic radiation. Now, what is characteristic radiation? This constitutes very small percentage of X-ray photons. Most X-ray photons are of Brahms-Starling type. Here, what happens is in characteristic radiation, the incident high energy electron which comes, okay, it will hit the inner shell electron. Inner shell electron, that is say K shell electron. Okay, it will hit the K shell electron. Okay, and there is a recoil electron, meaning the electron which comes will recoil back, and the electrons which is being displaced with is the photoelectron. Okay, and there is a vacancy created in the K shell. Okay, because of this interaction. Now, this vacancy which is created will be filled up by the outer shell, means higher shell electron. Okay, and then there is a release of the radiation or the photon, which is called as characteristic radiation or photon. All right, and then this vacancy is also filled up by outer shell electron, and the procedure continues. Okay, now why this is called as characteristic radiation? Okay, because the energies of this characteristic photon differs, or they are discrete. Okay, because they represent different energy shells. Okay, different energy levels in the specific orbitals. All right. So emitted photon which is emitted will be equal to difference in binding energy of the two electrons. Binding energy we discussed. initially. Okay, so the photon which comes out, okay, equals energy of photon equals the binding energy, difference in binding energy of two electrons in orbitals. All right. Therefore, they are named as characteristic radiation because each photon represents different energy levels. All right. Say example, if the L shell electron ka binding energy, say there is 100 kilo electron volts. Okay. So, uh, interaction with matter. Interaction with matter. Okay. Now, what we are going to be discussing here is when electron convert kinetic energy, okay, into X-ray photons. There are two possibilities which arises there, or two types of photons which are created, okay, by two different interactions. Okay, so first one is the Brahms-Starlung interaction or Brahms-Starlung radiation. The second one is the characteristic radiation or interaction. Okay. Now, what is Brahms-Starlung? Brahms-Starlung in German means Brahms-Starlung in German means breaking. Okay, breaking radiation, or it is also called as white radiation. Okay, it is also called as white radiation. What is this? Brahms-Starlung radiation. Now, this Brahms-Starlung radiation have got two possibilities. When electron come and hit the anode, there are two possibilities, two interaction that can take place in Brahms-Starlung radiation. Okay, so first one is the direct hit, second one is the near miss. Meaning what? When incident high energy electron comes and hit the anode, it can directly come and hit the nucleus of the atom. Okay, and there is a production of Brahms-Starlung photon of maximum energy. Okay, this is direct hit interaction. Near miss interaction, what happens is incident high energy electron comes and it passes by the nucleus. It comes and do not directly hit the nucleus. It passes by the nucleus, and the energy is also decreased and the path is also deflected. All right, the energy and path both are deflected in the near miss interaction here. Okay, and there is a release of Brahms-Starlung photon of lower energy. All right. So in Brahms-Starlung radiation, there are two possibilities: either direct hit or either near miss. Okay. Second one we have, and let me tell you, most of the interaction or most of the photons are of this Brahms-Starlung type. Okay. All right. Then we have characteristic radiation. What is characteristic radiation? Now, incident high energy electrons come and hit the anode. What happens is it will hit and hit the inner shell electron. It will come and hit the inner shell electron, releasing photoelectron, and this electron comes out as a recoil electron. Okay. Now there is a vacancy created in the inner shell. All right, inner orbit, like say example K shell. Okay, there is a vacancy created. Now what happens is the higher energy electron or higher orbital electron jumps off into the vacancy. created by this incident electron. Okay, and then there is a release of characteristic radiation or characteristic photon. All right, and then again this frequency is again created or filled up by the higher energy. So this process continues. All right, and the energy of you can say the photon, this photon, characteristic photon equals difference between difference between binding energy of two electron. Okay. Now what this means is if L shell electron have got, say, only I'm giving an example, L shell electron have got energy of 100 kilo electron volt, and K shell electron have got binding energy of 120 kilo electron volt. Why this is K shell is greater? Because it is closer to nucleus. So nucleus will hold this K shell electron tightly as compared to L shell, right? So the energy of the ejected, like characteristic photon, will be equal to difference between the energy, like 120 minus 100. So the characteristic photon the energy will be 20 kilo electron volt. Okay, just as an example, I am giving you to understand it better. All right, and why this is called as characteristic? Because they represent difference of energy levels. Okay, of these two electrons. Therefore, it is called as characteristic. And very small percentage of photons are of this type. Constitutes small percentage. All right, constitutes small percentage. All right. So I hope this concept is clear. Please say yes in the group. Understood the concept? Yes. Okay. Fine. Now, next interaction of X-ray with matter is the interaction of photons, okay, which are coming out of the X-ray tube with the tissues, okay, living tissues. All right. So, second interaction that we are, all right, very good. Understood. Interaction of matter, okay, is with the tissues. Now, in dental imaging, what happens is the X-ray beam which comes out of the X-ray tube enters through the patient. Okay, interacts with the hard and soft tissues. All right, and then it strikes the film which we keep in the inside oral cavity, or in cases of extraoral radiography, we keep outside the beside the face. All right, so what happens is when these photons comes out of the X-ray tube interacts with the hard and soft tissues, what happens is there is a process of attenuation. Attenuation means what? The absorption of these photons in the beam, okay, by atoms in the absorbing tissues, means through which tissues we are passing, those tissues, the atoms in that tissues will absorb these photons. Okay, there can be two interaction that take place. Attenuation is the word, the technical word. Okay, there are two possibilities when the photons passes through the tissues. First, the tissues can absorb the photon, or second possibility is tissues can scatter the photons. All right, so the frequency of both depends on the type of tissue. Frequency of both depends on type of tissues. Okay, hard or soft tissues. All right, so bone, say example, bone is most likely to absorb all the photons. All right, absorb all the photons. All right. So the bone appears radio opaque in the on the film. All right. You must have taken the X-rays or you must have processed the films. You see radio opaque or white areas and black areas. So white areas are radio opaque and black areas are radiolucent. All right. So bone mostly absorbs photons, so they couldn't reach the film, and therefore there are some white areas or radio opaque areas that you see on the film, right? You will understand why this becomes radio opaque and they radiolucent areas are formed after we discuss about processing of the films. All right. For now, you just understand what is absorption and scattering. Soft tissues, सॉफ्ट टिश्यूज जो रहते हैं मोस्टली दे लेट द photons pass through it because of atomic number. Soft tissues have got lower atomic number as compared to bone. Bone have got higher atomic number, so they absorb photons. Soft tissues will let photons pass through it. Photons pass through it. Okay. So the attenuated beam means the beam will pass through tissues. Either the photons will get absorbed or scattered depending on the tissues. Then the attenuated beam. After this procedure, the beam which comes out, okay, will have differential absorption of photons. Means if you pass the beam through here, okay, you have cheeks, soft tissues, you have buccal mucosa, then you have teeth. All right. So some photons will pass through it, some photons will be absorbed by the tooth. So the beam which comes out and hit the film, which we keep to take the X-ray of the tooth, will have differential, or you can say different energies of photons. Okay. And then it will form the image on the film. Okay. So attenuated beam will have a differential absorption of photons. All right. And in dental X-ray beam, there are three means of beam attenuation that can take place. Means there are three interaction that can take place that we are going to study. All right. And these are the interaction. Just remember, 9% of photons will have no interaction at all. They will directly reach the film like that. Okay. So 9% of photon will not interact at all. Other three interactions that we have is coherent scattering, which is 7%. Now, what is this? I'll explain. Okay. Photoelectric absorption 27% and Compton scattering 57%. Just remember the percentage of it and how this interaction takes place. There are three possibilities when the low energy, I'll just write down here, you just mention in your notes low energy incident photon, okay, less than 10 electron volt interacts with whole atom. Okay, this is coherent scattering. Low energy incident photon, less than 10 electron volt, interacts with whole atom. Second one is the incident photon. Incident photon interacts with inner shell electron. Okay, this is photoelectric absorption. Third one, which is Compton scattering. Compton scattering is the incident photon interacts with outer shell electron. Okay. So three possibilities: low energy incident photon, less than 10 electron volt, interacting with whole atom, incident photon interacting with inner shell electron, incident photon interacting with outer shell electron. All right. Let us start with the first, which is coherent scattering. coherent scattering. All right. It is also called as railway scattering, classical scattering. These are just synonym of it. You just remember the synonyms. Classical scattering, elastic scattering. Okay, the synonym of it. Okay, and 7% of total dental exposure happens due to coherent scattering. Okay, meaning what the incident photon comes and hit or vibrates the whole atom. Okay, comes and hit the whole atom vibrates for some time, becomes unstable for some time, and then this the photon which has come is scattered. Okay, scattered in different direction with low energy. All right, with low energy. This is coherent scattering. Now, what is what is photoelectric absorption? Now, this is very important to study the harmful effects of radiation. All right. Here, what is happening? Incident photon coming and hitting the inner orbital shell. We uh, we discussed same concept in the characteristic radiation, right? Incident photon coming and hitting the inner orbital shell. Okay, this electron come out as a photoelectron. Vacancy is created. Vacancy filled up by the outer orbital electron. Okay, giving us characteristic radiation. And then the higher energy level electron fills up this vacancy. And this process continues. All right. Now, here, what is happening is coming incident electron is getting absorbed completely, and the electron which is getting absorbed completely will be more harmful as compared to the electron which is getting scattered. So, this I'm sorry if I say electron, photon which comes, okay, getting completely absorbed by the tissues. So, it will be more harmful to the tissues. And 27% of primary image contributor is our photoelectric absorption. Primary image contributor. All right. 27% is this interaction, photoelectric absorption, and it participates. And this is primary image contributor. Uh, yeah, all right. So this depends on what the probability of photons getting absorbed depends on the atomic number. Okay, I already discussed the bone, which has got 6.5 times higher atomic number or thickness as compared to soft tissues. So bone is absorb the photoelectric absorption happening in the bone will be much higher as compared to the soft tissues. All right. This is photoelectric absorption. Now we have Compton scattering, which is the last interaction. What happens in this? Total of 57% Compton scattering happens. All right. Total of 57% happens. Why? Because what happens is incident photon comes and hits the outer orbital shell electron. Okay, and then incident photon will be scattered in different direction with lower energy, and this photon, which has some energy, will keep on hitting other atoms or keep on ionizing the other atoms. All right, so this interaction is harmful and it is contributing the most. But what it will do, it will just cause fogging on the film, causes fogging because it is giving us scattered photons. Okay, scattered photons will add no value to the no diagnostic value. Okay, and it will just be a low energy photons reaching towards film, and they will just fog the film. Fog means fogging. You will understand in development. Okay, just causes fogging. And there are some scattered photons reaching the film. Okay, so this incident photon. will give a scattered low energy photon. This will keep on ionizing the atom till its energy becomes zero. Okay, so this is basically a quantum scattering, right? And, scattered photon will continue to ionize in different direction. It will exit the patient and strike the film and just degrade the image. It will not add diagnostic value in the image or the film. Okay, so this is basically content scattering. You just need to remember the how much percentage it contributes to and what is the significance. Okay, all right. I hope this is understood. Yeah, I understand this is a complicated concept, but if you understood, you can just say yes or no, whatever. Understood, guys? If not understood, that's okay. You can just remember important points in this. All right. Just a theory point of view, it is important in your final year exams, and but MCQ point of view, you just need to remember the percentage of it. What is the significance of it? What is the primary contributor uh, in the image formation? All right. Okay. Can we move on further? Shall we move on, guys? If you want some time to write down or ask doubts, you can ask. Okay. Now, the important aspect of we have completed with radiation physics means what? How the X-rays are produced. What is the factors affecting this as X-ray production? What are the interaction happening inside the X-ray tube when X-ray photons comes out of the X-ray tube? What is the interaction happening with the living tissues that we studied? All right. Now important thing is what effects study of effects of ionizing radiation on living systems we are going to discuss. All right, so starting with the radiation biology. All right, radiation biology is basically study of effects of ionizing radiation on living system. Okay. Now, there are two effects that can take place when when this ionizing radiation pass through the tissues. Okay. Direct effects that can take place. There are indirect effects that can take place. All right. What is direct effect? Okay, direct effect when the photons hit the tissues. All right, energy of photons is directly transferred to the biological macromolecule, causing damage. Biological macromolecule, DNA, RNA, mitochondria, etc. Okay, so direct effects where the energy of photons is directly transferred, okay, to biological macromolecule. This is direct effect. Okay. What are indirect effect? So our body consists of 70% of water. All right. Now what happens is when photons comes and hit the tissues, what happens is there is ionization happens. H2O, ionization. That's why I first discussed about this basics. Uh, what is ionization? What is an ion? How this ionization takes place? All right. So there is ionization of water occurs. This ionization gives rise to the free radicals. This ionization gives rise to free radicals. Okay. So we have peroxide ion and we have hydrogen peroxide ion. Right? These free radicals which are formed are very harmful or more damaging. Okay. And therefore it is called as indirect effect. Photons coming, ionizing water molecule, forming these free radicals. These free radicals are more harmful to our tissues. All right. Therefore, it is called as indirect effect. Direct effect, photons just come and hit directly onto the macromolecule. All right. So this is difference between these two. Now we have something called as stochastic and deterministic effect. Okay. Here also I have a picture where radiation exposure, ionization causing this free radicals, indirect effects on the tissues. Direct effects, radiation or photons coming and hitting the tissue, direct effects. All right. Now, deterministic and stochastic effect. What are those? Deterministic effect. Deterministic effect. Okay. Deterministic effects are seen when the dose exceeds threshold dose or threshold level. Okay. Exceeds threshold level. Okay. If we draw a graph of dose and effects, okay, deterministic effects are seen when this is the threshold dose. Above this dose, the effects are seen. Below this threshold dose, no effects are seen. This is called deterministic effect. Okay. And the severity of the effects depends on the dose. As we increase the dose, severity also increases. All right. And main important thing is below this threshold dose, no effects are seen. Just write down, this is very important difference between deterministic and stochastic effects. Stochastic effect. Stochastic effects. Stochastic effect does not have any threshold dose. Any small dose can also bring changes, stochastic changes in the patient. All right, it does not have any threshold dose. Any dose, any small dose is potential to cause effect. Okay, and the probability of the stochastic effect increases as dose increases. Okay, probability. probability of stochastic effect increases as dose increases. Meaning, if the graph of stochastic effects and dose, when you increase the dose, it does not have any threshold, right? When you increase any small dose, can bring out the change stochastic effects. So this is a stochastic effect. So this is the difference between these two. Now, okay, example they have given here. Deterministic effect. Example: xerostomia, osteonecrosis, cataract, decreased fetal development are all deterministic effects. Mean they are seen when particular threshold dose is crossed. Below that threshold dose, no, these effects are seen. All right. So xerostomia, osteoidecrosis, cataracts, decreased fetal development. Stochastic effect. Just look at the example: leukemia, thyroid cancer, salivary gland tumors, heritable disorders. These all are the changes when any small dose can bring out this mutation and can bring out this stochastic effects in a patient. All right. So this is basic difference between deterministic and stochastic effect. I hope this is clear. All right. Now, important thing is you have seen this cell to survive. All right, or goes through this cell cycle. Okay. So we have this G1 phase. We have the synthetic phase. We have this G2 phase. We have mitosis phase. All right. Now, which phase is more radiosensitive? Which phase is least radiosensitive? All right. So, these two are most radiosensitive. Okay. These two phases are most radiosensitive. S phase is least radiosensitive. Yeah, stochastic effects, meaning we are not talking about an operator or a patient or a technician. It is common to all. Okay, it can bring out change in any of the patient or any of the person, not specifically an operator or a dentist or a patient. All right, it is common to all. We are talking about general effects that can take place due to this ionizing radiation. Okay, Pratik? Okay. So synthetic phase, synthesis phase is the least radiosensitive phase, and G1 phase is less radiosensitive. All right. So you get MCQ that which of the following phase is most radiosensitive phase. So your answer should be mitosis, either mitosis or G2. They'll not give you both, or if they give you both, then the option will be both A and B. So you will mark this. All right. So this is the cell cycle. Importance of the radio sensitivity to cell cycle. Okay. Now, uh, what is next important thing is uh, in oral cancer or any cancer, talking about radiotherapy, especially radiotherapy to oral cancer patients. Okay. What we give radiotherapy, chemotherapy, and in sometimes surgery followed by this radio and chemo. Okay, according to the grade of the cancer. All right. So radiotherapy is administered to the patient, and what is the dosage? Radiotherapy is administered. Okay. If we consider 1 week radiotherapy, then we give is for 5 days or for 6 days. For 5 or 6 days, we give dose of daily. All right. Okay. And we give it till we complete 10 grays. All right. 2 grays. Why we are not administering 10 gray at once? Why we are fractionizing the doses? Why we are fractionizing? Because what happens is if there is a tumor, okay, consider this is a cell. This is a tumor. Okay, tumor cells. This uh, so these are the normal cells. Okay, these are the normal cells. When you give radiotherapy in this area, what happens is there are some cells which are getting damaged by this radiotherapy. All right, say one or two cells, not all, but one or two cells surrounding that tumor cells are getting exposed to the radiation, right? So they are also getting, uh, affected by this radiation, right? So why we give this fractionization dose? Let this surrounding cell repair cells, okay, which are getting damaged due to this radiotherapy. But now there are more advanced technique that have come, which just focuses on the tumor cells. All right, but then also there are some cells which are getting affected and they need time to repair themselves. All right, so that is why we give fractionization, or we give doses in fractions. All right, so radiotherapy continues for 6 to 7 weeks. 6 to 7 weeks till we complete 60 to 70 days. Okay, till we complete 60 to 70 grams. Now, this much doses are, or patient is getting exposed to. Okay, now there are some side effects of radiotherapy that uh, you see, starting from the oral mucous membrane. How the oral mucous membrane will be affected? After second week of radiotherapy, what happens is, okay, after second week of therapy, what happens is, the radio sensitivity of cells depends on the dividing capacity also. So after this topic, I'll tell you I've just put up the tables where you can just remember the radio sensitivity of the cells, highest radio sensitive cells, lowest radio sensitive cells. All right. So after second week of radiotherapy, what happens is there are basal cells. If you know the layers of oral mucous membrane, there are basal cells. There is spinosum layer, right? There is a granulosum layer, and there is then the corneal layer, right? All right. So the basal layer, which is there in the oral mucosa, it is rapidly dividing, rapidly dividing. So they are more prone to this radiation. Okay, rapidly dividing. So they are more prone to the radiation. And what happens is, after second week of radiotherapy, uh, there is a formation of white to yellow pseudomembrane. These cells, basal cells, are affected, and there will be formation of pseudomembrane. White to red pseudomembrane formation. Okay, there will be areas of redness and inflammation that you see. Okay, uh, when we continue the radiotherapy, the glucosa becomes more atrophic. Okay, more atrophic, and avascular. Okay, and a long-term atrophy. This Continue this process, continue, and long-term atrophy results in what? Fibrosis. Okay, fibrosis in underlying connective tissue. Okay, so when the patient comes to you and he will give history of undergoing radiation therapy, just observe the mucosa. It will be dry, the pseudomembrane formation is there, and it is called as radiation mucositis. All right. And after radiotherapy has been completed, if you follow up the patient, you will see the fibrosis. Okay, there is reduced mouth opening. You can just palpate the mucosa. There will be atrophy and thin mucosa will be there. All right. So these are the after effects of radiotherapy on mucous membrane. Mucous membrane. All right. Then we have the salivary gland. What are the effects of radiotherapy on salivary gland? So, the salivary gland is in the path of radiotherapy. All right. Then what happens is 20 to 30 gray radiation. Okay, salivary gland is unavoidably exposed to this much of radiation. Okay, and what happens is then marked progressive progressive decrease in salivation, decrease in salivation seen, right? And first week of radiotherapy, you see these saliva getting decreased. Patient will tell you complain of dry mouth first week of radiotherapy. Now, extent of the salivary flow or reduced flow depends on how much dose this patient getting exposed to. So, salivary secretion becomes zero at 60 gray. Okay, it becomes zero at 60 gray. Mouth becomes dry, swallowing becomes difficult, swallowing becomes difficult. All right. If some portions of major salivary gland, if it is, you can say, spared, okay, what happens is if some portion or some cells of salivary glands are spared, okay, then the dryness subsides. The dryness subsides in 6 to 12 months. 6 to 12 months में due to hypertrophy of these redeeming salivary cells. Trophy of cells, the dryness subsides. Okay, there is a little secretion of saliva happening. Okay, so these are the effects of radiation on salivary gland. Now, when salivary gland is affected, there is decreased saliva, as we all know. Decreased salivary flow, meaning reduced pH, meaning decreased buffering action of saliva in the oral cavity, increased viscosity of saliva, and altered flora. Now, this, as a consequence, will lead to radiation caries. Okay, radiation caries due to reduced saliva. pH decreases, buffering action decreases, viscosity increases. Okay. Greater than 30 gray dose if patient is getting exposed to radiation caries are seen. greater than 60 gray if exposed to, then pronounced radiation carriers are seen. Okay. Now there are three types of radiation carriers that is seen. First, buccal, incisal, palatal, or occlusal. There are superficial lesions affecting these surfaces. You will be able to see. The second type that we have is the cementum and dentin in cervical region are affected. Okay. And then you see the apple core pattern. What is this called as? Apple pattern. When you eat apple and you keep that central part as it is like that, the caries, the pattern of the caries is like that. So it is known as apple core pattern. Right? Third type that we have is the dark pigmentation. Brown becomes excessively pigmented crown. So these are the three types of radiation carriers that you can see. Radiation carriers are rampant carriers, okay, who receive the course of radiotherapy, okay, that includes exposure of salivary gland. Consequence of that, reduced saliva, there is a radiation carries occurring in the patient. All right. Uh, okay. Next, we have the radiation effect of radiation on bone. Very important. Okay, so primary damage to mature bone results from radiation. Okay, induced damage to vasculature of bone. Okay, the term osteoradiosis comes into play here. Okay, so effect of radiation on primary damage to mature bone. Okay, how this happens is damage to vasculature, damage to vasculature of bone. Okay, so if high dose greater than 60 we give, okay, it does affect on blood vessels. Okay, there is decreased blood supply. All right, and then the decreased blood supply is more commonly seen in mandible as compared to maxilla. Okay, and the bone then becomes hypovascular, hypocellular, and hypoxic. Okay, bone becomes hypovascular, hypocellular, and hypoxic. And then, if we the irradiated bone, the bone which is getting irradiated, exposed to trauma. What kind of trauma? Such as if we do tooth extraction in that condition, if we do surgeries, third molar extraction, okay, then what happens is large sequestra forms, okay, or dead bone get exposed to the oral cavity. All right, and that causes intense pain. Okay, in this situation, if we do some procedure, if we cause some trauma to that bone which is irradiated already, okay, that can cause the bone getting exposed to the surrounding, and then it causes intense pain. Okay, and that is then called as osteoradionecrosis. So what we do is, if a patient is going to undergo radiotherapy, beforehand only we do all the procedures, okay, which can cause trauma to the mucosa, so that all the infections, all the you can say carious tooth is removed, and then after 2 weeks of healing the tissue and all, we can send patient to radiotherapy. All right. Okay. So this is about osteoradionecrosis. And what is the treatment that we give to the patient of osteoradionecrosis? It's a hyperbaric oxygen therapy. Treatment is hyperbaric oxygen therapy. And what is the regimen that we follow? One dive of 100% oxygen at 2.5 atmosphere for 90 minutes. Okay, just remember this. All right. Okay, now the effect of radiation on developing tooth. Okay, on developing tooth. Okay, there's a development stage going on, and then we expose patient to the radiation. What happens is there is destruction of tooth birth that can replace absence of tooth. Okay, hypoplastic tooth or decrease size of tooth. Decrease size of tooth. All right. The effect of radiation on musculature, muscles. Okay. So radiation may cause inflammation and fibrosis, okay, resulting in contracture and tenesmus. Okay. So it can cause inflammation and fibrosis. Okay. Resulting in contracture, tenesmus. Okay. In muscles of mastication. In muscle of mastication. All right. And restriction of mouth opening starts after or starts 2 months after radiotherapy. Means if patient start the radiotherapy today, after 2 months he will notice that in the reduction in mouth opening. The reason is what? The effect of radiation on muscles. Okay, after 2 months patient will find the mouth opening is getting reduced. All right, so these are some effects of radiation on different uh, structures. All right, I hope this the concept is understood up till now. Understood the concept, guys? Please reply so that I can proceed further. Or else, if you have got any doubts, you can ask right now so that your concept gets clear. Okay, understood. All right. Okay, now what we'll do is we'll start with the Excel phase, accessories. Okay. See, X-ray film is what? It helps to record the information, all right, regarding the tissue through which X-rays pass. All right. Or you have image receptor in place of films also. Okay, you have sensors. If you have seen RBGs or digital X-ray in some clinic, okay, you have sensor for recording the taking the X-rays. That is called as image receptor. Okay, so it can be modified. The image receptor can be a film, or it can be modified by adding some extra accessories to it. Okay, that we'll discuss now. XC films are basically divided into intraoral films and screen films. Okay, intraoral films and screen films. Now, intraoral films we have is the IOPA, intraoral periapical radiograph. Okay, IOPA films. And these intraoral films are called as direct exposure films. Direct exposure films. Okay, the screen films are what? They are used with intensifying screens. They are used with intensifying screens. Now, what are intensifying screens? We'll discuss it. Okay. Intraoral film, direct exposure, you can put it directly into the oral cavity and you can take the X-ray. Screen films are mostly used with the extraoral radiographs. Extraoral radiographs. Alright. Intraoral film includes IOP, occlusal film. Okay. And the third one is the bite wing film. Alright. IOP film comes in three sizes. Number 0, which is for children. See, you need to remember the sizes and the number. Okay. You can get questions based on this. Number 1 film is of 24 into 40 mm. It is used for adults and for anterior teeth. Number 2 films is most commonly used. The size is 31 into 41 mm, used in adult posterior teeth. Okay. Number 0, we use it children's. Alright, this is about IOPA film. Then comes occlusal film. Occlusal film is also called as bite film, or it is also called as topographical film. Right? Topographical film. The size of it is 57 into 76 mm. Okay. Next we have is the bite wing film. Bite wing film. The sizes of bite wing. Number 3. Number 0 is for child posterior tooth. Number 1 is for child anterior tooth. Number 2 is for adult posterior teeth. Number 3 is for adult anterior teeth. Alright. This you can remember, but most important is the occlusion and the IOPA. Okay, bite wing they can ask rarely, but IOPA film and the occlusal film they can ask very often. Okay, now screen films. Screen films are what? They are used with intensifying screens. Okay, intensifying screens are mostly used to take extraoral radiograph. So extraoral radiograph we take using this cassette. Okay, I'll show you the cassette. Okay, so we have screen films that we put into the cassette, and the cassette has already intensifying screens are already placed or incorporated into the cassette. Okay, and then we open the cassette, we put screen films inside that cassette, and then we take the external radiograph. Okay, now screen films are of two types. Okay, two types: blue light sensitive Now, what is this blue light sensitive and green light sensitive? Once we discuss intensity and screens, you will get to know. Blue light sensitive, and then we have green light sensitive screen films. Blue light sensitive depends on the material used for the composition of the film. Okay, so blue light sensitive screen films are made up of crystalline calcium tungstate. Okay, crystalline calcium tungstate. Then green light sensitive film is made of earth materials, rare earth. Uh, Example, you write it down here. Green light sensitive rare earth elements. First we have is the terbium activated gadolinium oxysulfide. Second material that we use is a thallium activated lanthanum oxybromide. Okay, so these are the material by which green light sensitive films are made up of. Very important, need to remember. All right, and the extraoral films that we use commonly of size 8 into 10 inches. There are different sizes for TMJ radiographs, for skull radiographs. There are different sizes 8 by 10, 5 by 7, 10 by 12, but most commonly used size is by 10 inches. All right. Okay. Then we'll move on to this composition of film. Before that, how the film, you must have taken the radiograph in your radiology postings. You must have seen this film. Now, the layers of the film you need to know. All right. So, X-ray films is basically it has two sides, towards tube side and opposite side of the tube. Okay. So this is opposite side of the tube. All right. And the side that faces the tube, okay, is the main side that we need to know. Okay. Then we have inner paper, black paper. Okay. Then we have the film which is kept between those black paper. Then we have this lead foil backing. All right. And this outer package is a plastic, made up of a plastic. And this is basically waterproof. Okay. To protect it from the saliva. All right. So this is basically composition of the film. Not composition. This is a basic structure how the films is kept. Okay, what are the layers of the film? Now we'll move on to the composition of the film. Composition of film. Okay, so composition basically we have this base. Okay, base. Base is layered with the uh, emulsion. Okay, both sides we have the emulsion. This is emulsion. 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 All right, and the emulsion is then protected with the overcoat. This is protected with the overcoat. Overcoat. Overcoat is just a protective layer, alright? Now, the thickness of the base. This is a film, alright? Film ka layers. So base has a thickness of 0.18 mm. Okay, base has a thickness of 0.18 mm. Then we have emulsion over it. Then we have a overcoat over it. Overcoat is just a protective layer. Now base is made up of first base is made up of polyethylene, polyethylene terephthalate, terephthalate. Okay, polyethylene terephthalate. And when it is made up, this is an extra point that you remember. When it is called as safe film, okay, then the base is made up of polyester, acetate polyester, acetate polyester. Then it is called as safe film because it is not inflammable. Because it is not inflammable. All right. So base is made up of polyethylene terephthalate. Second one, we have the emulsion, which is very important when we study about processing of the film. This emulsion comes into play. Okay. Second one is the emulsion. Emulsion basically made up of silver bromide crystals suspended in gelatin. Okay. Emulsion is made up of silver bromide crystals suspended in gelatin. All right. And these crystals, silver bromide, to be very specific, silver halide crystals will be here. And then these silver halide crystals consist of silver bromide crystals and silver iodide crystals. All right, silver bromide and silver iodide. Silver bromide uh, contributes approximately 80 to 99%. Whereas silver iodide is a small amount, 1 to 10%. Okay, so emulsion made up of silver halide crystals suspended in gelatin, and silver halide crystals again have this silver bromide and silver iodide divided into these two. In that of the silver iodide, small amount, silver bromide is most or maximum amount of silver bromide is present. Silver iodide has sensitivity. Silver iodide has sensitivity to the emulsion. Okay. Then third, we have a super coat. Super coat. Okay. Now super coat just protects the film during handling. Super coat just protect the film during handling. Alright. Uh, this is clear. Again, this gelatin. Gelatin is made up of cattle bone. Very important thing is emulsion. Emulsion made up of silver halide crystals, that too silver bromide and silver iodide. Silver iodide just adds sensitivity. Okay, how you will get to know in processing or formation of latent image. Okay, so this is about composition of the film. Okay, now you have something called as intraoral film speed. The concept of intraoral film speed. Now, this is intraoral film speed. Speed notes the amount of radiation, required to produce radiograph of standard quality. Okay. Now this speed depends on what factors? Speed depends on first size of halide crystals, size of halide crystals. Second one, thickness of emulsion, thickness of emulsion. Third one is the presence of radiosensitive dyes, presence of radiosensitive dyes. Now, what is this film speed? When you buy the film, okay, the packet of the film, they'll ask you which speed do you want. In dental radiography, only D and E speed films. This is an important point. Only D and E speed films are used in intraoral radiography. Okay? When you start with A, comes to F. A is the slowest speed and F is the fastest speed. Okay, so speed. What is the significance of it? Fastest speed requires less radiation. Okay, less radiation since halide crystals are larger. Just correlate how this is going. The size of halide crystals, the speed of the film. When you take highest speed film, the radiation requires will be low and the dose to the patient will be low. Okay, therefore we use fast film speed, or we should use fast speed film. All right. Okay, so this is about intraoral film speed. Now we have something called as intensifying screens that we were
कहाँ है यार दुकान पे है वो पूछा तो था मैंने
was talking about intensifying screens. Okay, intensifying screens, the name itself is suggesting it intensifies the you can say action of X-rays. Action of X-rays. Alright, intensifies action of X-rays. Now, when you look at this, see, I was talking about cassette. This is a cassette, extraoral cassette. Inside this cassette, we have the intensifying screens already placed. Okay, this is a white cardboard sheet like paper, which is there inside this cassette on the sides of the mouth of the cassette. Okay, in that cassette, when you open it, you keep this film, which is our screen film, which can be blue light sensitive or green light sensitive based on the composition. All right. When you place the film inside cassette, you close the cassette and then you take the X-ray. All right. Now, what does this intensifying screens do? Okay. Intensifying screens basically, this is the cassette. Okay. This is the intensifying screens, the layer. Intensifying layer. Intensifying layer. Okay. Now, this intensifying presence of intensifying screens creates a receptor that is 10 to 60 times more sensitive to X-rays than film alone. Okay, when you expose film alone, it requires more radiation, and when you expose film with intensifying screen, the intensifying screen adds more value to the you can say uh, during taking the X-ray. Okay, what happens is basically this is intensifying screens, and then in the middle of it we keep the screen film. When you expose the cassette, okay, these are X-rays. What does intensifying screens do? It will convert this X-ray into visible light, okay, into visible light. It will convert those X-rays to visible light. Visible light will expose the screen films and we get the image. You got it? And intensifying screens are made up of or composed of what? It is a smooth plastic sheet composed of minute fluorescent crystals. Fluorescent crystals called as phosphor. Okay. So these are basically phosphor crystals. Okay. We expose it with the X-rays. Okay. This phosphor layer will intensifying or convert it into visible light. Visible light then exposes the screen films. Therefore, I was talking about the blue light sensitive and green light sensitive, depending on the composition of film. Okay, it will be exposed to the radiation. All right. What is the importance of intensifying screen? It will reduce the dose to the patient. All right. I hope this concept is clear. Clear, guys? Shall I move forward? If there are no doubts or everything is clear, I can move further. Anybody awake or everybody slept? Yes, okay. Awake, awake, awake. Good, good. No doubts till now? Uh, I've already told you in first half. I will ask one question. Why the X-ray tube is evacuated? That answer I'll ask at the end of the lecture. Please think and keep it ready. Okay? Okay. Moving forward, you have again one accessory which is very important, which is called as grid. Okay? It is called as grid. Now, when you use grid with the this extraoral cassette, okay, what happens is It reduces amount of scattered radiation. Okay, this grid reduces amount of scattered radiation. Okay. Now, how this reduces amount of scattered radiation? When you keep this uh, grid, okay, what happens is the radiation comes. There are some primary radiations. There are some scattered radiation. What will grid do? We keep the grid. Okay, the scattered radiation will come, which comes out of the patient. It will be restricted by these grids. Okay, and the image that you get will be more clearer. If the scattered radiation reach the films, what happens is it just degrades the image. It just blurs the image. All right. But when you keep the grid, what happens is the scattered radiation are restricted due to this grid. Only the primary radiation will pass through it and will give you more clearer image. All right. Now there are two types of grids which are present. Okay. First we have is the stationary grid. Stationary grid. Second we have is the moving grid. Okay, moving, it keeps on moving. Okay, stationary, you just keep it with the cassette. Okay, so stationary moving grid is also called as Potter Bucky grid. This is very important. No? Synonym. Moving grid is also called as Potter Bucky grid. It moves sideways. Okay, it moves sideways. Okay, and what is the disadvantage in the stationary grid? You will see the grid strips onto the X-ray film. If this is X-ray film, you will see this light, this strips. Okay, light, very light grid strips. Okay, on the film. But when you use moving grid, the it blurs out. Moving grid blurs out the grid strips. Okay, mostly we use it with the extraoral radiographs. It prevents scattered radiation to reach to the film. All right. Uh, and the next thing that we have, I already told you that factors affecting X-ray production includes filtration and collimation. Now we are going to discuss this in detail. All right. Filtration. Now, at the start of lecture, I explained the tube head. All right, tube head, and at the port of tube head or window of tube head, uh, at the starting of PID, positioning indicating diode, positioning indicating device, we have the aluminum filter over there. Now, what is the use of aluminum filter? It removes unwanted radiation. Unwanted radiation. That means the low energy photons which are there, which will just go and fog the film. This filtration or filter will restrict those unwanted radiation. Okay, so filtration in the X-ray tube is inherent, and some added filtration is also there. Okay, so total filtration will be inherent filtration plus added filtration. Inherent means the X-ray tube will also help to remove the unwanted radiation. Okay. Added filtration, we add extra layer or extra thickness of aluminum at the window. Okay, at the window of tube head. Okay, so that there is more added filtration, added restriction of the unwanted radiation is there. Okay, and most commonly used filter is aluminum filter. Okay, and if your machine is working up to 70 kVp, which is a voltage, then you add filtration of 1.5 mm. Okay, if higher voltages machines are being used, then you take 2.5 mm of thickness. Yeah, this is the thickness of aluminum that we use. Thickness of aluminum. All right. We'll just wait for 5 minutes, then we'll continue. All right. Up to this, I hope you understood. So, aluminum filter is there at the X-ray tube window or a tube head window. All right. And the thickness of aluminum that is mandatory for um, uh, machine working up to 70 kVp is 1.5 mm. Whereas if machine is working at higher voltages, then we take aluminum. The thickness which we need is 2.5 mm. All right. Uh, then we have the concept of collimation, which also is important factor affecting X-ray production. Okay, what is collimation? Collimation is you can say controls. Collimation controls size and shape of the beam. Size and shape of the beam. Okay? Collimator is basically made up of the lead. Okay, collimation controls size and shape of the beam. Now, you have different types of collimator, different shapes. We have diaphragm collimator. Second one, we have tubular collimator. Third, we have rectangular collimator. Okay, and then we have slit collimator. These are types, different types. Slit collimator is used in OPG machine. Please write it down. Slit collimator is used in OPG machine. Alright. Now, why rectangular? Rectangular is better as compared to round. Okay. Rectangular collimator is better. Why? Okay. As you look at this illustration, what is there? This round. Okay. This round is the collimator shape. And the film that we use is number 2 size 2 IOP film. Alright. If we use this collimator, look at the excess area that is getting exposed to radiation. Alright. This is the size of film. This is a round collimator. Let's say we'll expose this much of area. So look at the area, excessive area which is getting exposed. All right. Second one we have is the rectangular column. The black area shows the excessive area which is getting exposed to rather if we compare it with the shape. All right. This is rectangular collimator and the inner white is the film number 2 size 2 IUPA film. And look at the area which is excessive area which is getting exposed. This is too little as compared to this area, right? Therefore, rectangular collimator is better than the round collimator. And this concept is applied in radiation protection also. When we talk about protecting the patient, using rectangular collimator is better because the exposure area which is getting exposed to, okay, is lesser as compared to the round collimator. All right. So this is about collimation. Okay. I hope up to this everybody understood everything.